Hi, everybody. This is Dr. Carla DiGirolamo, reproductive endocrinologist at Boston IVF, Crossfit Level 1 trainer, and certified nutrition coach. And what I'm going to be talking to you about today is about being active, what is safe, what do you want to do, not to do when you are undergoing a treatment cycle for in attempts to conceive. So the first thing when I have my own patients and other people who ask me about this is the first thing you need to consider is your baseline level of fitness. What do you do on a regular basis for fitness? Are you an elite athlete? Are you sedentary and you haven't stepped foot in a gym in 2 years? Or are you somewhere in between? But when you're thinking about how active you want to be, you can always revert to your baseline level of fitness, because the recommendations for one of my professional athletes that I may be taking care of is going to be very different from the sedentary individual that I might also have in my practice. So that's the first thing. The second thing is we want to consider what type of treatment cycle are we doing? Are we doing Clomid? Are we doing letrozole? Are we doing injectable hormones and IVF? Are we doing a frozen embryo transfer cycle? They're all a little bit different. Basically, the rule of thumb is if you're taking injectable hormones, okay, then you may need to modify what you are doing physically during the time you're taking those injections. And the reason why is because injectable hormones tend to be very potent. They create a lot of and stimulate a lot of follicles in the ovary. Even when we're using really low doses in the midst of an IUI cycle, still the ovary can enlarge, cysts can form, and the risk is that the ovary will twist on itself, and that's called an ovarian torsion, which is a situation we want to avoid because it can result in reducing blood supply to that ovary and possibly needing surgery to rectify that situation. So we do want to avoid ovarian torsion. And so if you are in a gonadotropin cycle, IVF or IUI, the way you want to modify your movements is to avoid high impact movements. That would be anything that involves jumping, anything that involves a lot of bouncing. That could be horseback riding, running typically falls into that high impact bouncing category, and also turning upside down. You might think, oh my God, who turns upside down? You'd be surprised at who turns upside down. Many of our yogis will turn upside down and do headstands. Downward dog is okay, as long as your ankles stay below your hips, that's okay. But a lot of my CrossFit athletes are turning upside down, doing handstand push-ups and handstand walks and things like that. So if you are a yogi or a CrossFitter, you definitely don't want to be turning upside down, and you want to avoid that jumping and running. Any other activity is okay. Lifting weights is okay. Resistance training is okay. Walking is always okay. And biking. I have had some athletes in my practice who are training for events and, really can't take 2 or 3 weeks off completely from training, nor should they. So instead of having them running and training for their marathon, I have them on a spin bike, and they are still maintaining the level of fitness while they're cycling in a very safe way. But for other people who are, and that's most of us, who are recreational athletes, you want to just, if running is a usual thing, you want to just modify that and just stick with the staying right side up and not running or jumping. Now, during Clomid cycles, letrozole cycles, frozen embryo transfer cycles, the ovaries aren't being stimulated to the same extent, and so that risk of torsion is much lower. So you really don't have to be quite as strict about reducing those activities. You can probably still perform those very safely. But, if you are in a Clomid cycle and you are finding that your ovaries are very enlarged and you're very aware of your ovaries, then use your best judgment and, maybe avoid the turning upside down, running and jumping. But otherwise, swimming is an excellent activity. Like I said, if you do fitness classes, you want to just stay on the ground instead of jumping in the air. So that kind of leads into the next point about heart rate. You're going to hear people sometimes say, oh, you can't get your heart rate up. And that has been debunked. If you read the literature in the fitness world, and even some of the citations with the American College of OBGYNs, the heart rate guidelines have been debunked, and there really is no evidence to support any heart rate limitations, either while you're trying to conceive or even after conception. It is safe to get your heart rate up. It's really okay. But the caveat is you got to listen to your body. I mean, if you're sometimes in early pregnancy, you might feel lightheaded, dizzy. That's not the time to be, sprinting across the finish line. You want to listen to your body. And if you're not feeling well, it's okay. That you don't have to take that run. You can go ahead and take that walk. So keep in mind, heart rate limitation, there really is no evidence to suggest that you have to keep your heart rate between a certain range. It, again, all goes back to what your natural fitness level is, what your normal fitness level is. The other thing I encourage people to do is get outside. Even in the wintertime, here in New England, we know that the weather is crazy, but lots of studies show the benefit of nature, having nature around us and having that relaxation time to connect with your body, your mind, and with nature. And just getting outside for a walk is a really, really great thing to do. It can be very invigorating. It can clear your mind, and the mind-body connection is just as important as your physical activity, especially when you're doing a cycle, because these cycles can be so stressful for people. So definitely get outside. Hiking in the woods is wonderful. Take your dog with you, and that is a great way to stay active when you're going through a cycle. And then lastly, I alluded to this before, you want to listen to your body. You're going to have good days, you're going to have not so good days. Some days you might be feeling like you're going to cry when the car commercial comes on. Other days you're going to feel like you can run that 10-mile. Take it day by day and be ready to make changes. If you're planning on going out for that run on a particular day and you wake up and you don't feel like it, that's okay. I know many people who are avid exercisers and athletes can sometimes beat themselves up when they are not feeling like they can do what they usually can do. When you're on hormone therapy, whether it's Clomid or whether it's gonadotropins, this can really make life's experience a roller coaster, as I know many of my patients know. And now's not the time to beat yourself up over not being able to do something you want to do. If you're faced with that, maybe say, okay, I'm going to take that walk outside, or maybe I'm going to sit and do 15 minutes of meditation or yoga. Now's the time to give your body what it needs, whether you really feel like you need that 5K. And if you are a runner and you are a marathon runner, you can do a 5K for a warm-up and go out and take that run, and you'll feel so much better after. If you're somebody that never goes to the gym, go out and take that walk. Walking is always okay. So those are the 5 things. Start with your baseline level of fitness. Keep in mind that heart rate limitation, there are no heart rate limitations. Those theories have been debunked. You want to keep in mind what kind of treatment cycle you're doing and what kind of medications you're using. You want to get outside, and you want to listen to your body. So with that, you should have a safe and happy IVF cycle that's going to keep you healthy and hopefully give you your best chance of success. Good luck, everybody. Thanks for listening.